Well, welcome to the first lecture, and this one is devoted to terms and concepts about treatment and health services research. Like any other area of clinical services, there are lots of technical terms, and when you get more into the research, they merge with lots of important scientific concepts. So I'm going to encourage you to become familiar with these terms and concepts. Try to define them informally for yourselves, but if you need a formal definition, we will post on Blackboard a glossary of terms that you can refer to. I'm just going to cover the most important ones that will be repeating themselves on a regular basis throughout the lectures in this course. For example, what is treatment and how is that distinguished from early intervention and harm reduction? These are three major areas of health services research in the addiction area. Other concepts related to this course start with the continuum of severity of an addiction disorder, which ranges from no use to recreational use to use that presents the risk of problems, which we call hazardous use. And further down the continuum, we have harmful use of alcohol and other substances. Hazardous drinking and hazardous drug use represent use that raises the possibility of developing a problem, like becoming intoxicated, but not necessarily having that problem. Harmful use represents use of a substance that results in some sort of negative consequence. And finally, we're going to be talking a lot about substance use disorders. And at the core of this concept of substance use disorders, we have what is called the dependence syndrome. Dependence is a condition that changes a person's behavior, their thinking, and their physiological functioning. And it is epitomized in the stereotype of an alcoholic or a drug addict. People whose lives are out of control, they can't control their substance use, they get up in the morning, they have to administer the substance, or they experience withdrawal symptoms. They can tolerate very high amounts of the substance, and it affects their behavior. They're always thinking about the substance, how to get it, how to use it. They narrow their lives around the use of the substance, ignoring more important things in their lives like family and friends and work. And that cascades into a situation where they're no longer able to function in society. And that is usually the target of most treatment programs. Treatment outcomes. This is something we're going to be talking a lot about because treatment services are designed to produce a reduction or a cessation of substance use. So treatment outcomes will be a major focus of this particular course, how to measure them, how to interpret them, and most importantly, how you can organize treatment services to produce favorable, beneficial treatment outcomes. There are other terms that we'll be talking about. Treatment process. What goes on inside a treatment episode or a treatment program? The interaction with the therapist, the alliance that develops between a patient and a therapist, and all the things that help us to understand the mechanisms by which treatment is effective or ineffective. Relapse is a term that we'll be using quite often, and as you might expect, it means that after a period of abstinence, someone begins to use that substance again. And relapse can be precipitated by internal conditions like depression or anxiety. It can be precipitated by external conditions like the environment that somebody is in. So we've got to understand that in order to design better treatments. And indeed, one of the most effective types of treatment has been what is called relapse prevention, teaching people how to prevent the onset of relapse by training them in skills that lead them to avoid situations that precipitate relapse in the first place. If the treatment process works, if relapse is prevented, if treatment outcomes are favorable, then what we have what is called recovery. Recovery is the goal of all treatment programs. Getting the person who has gone through often months to years of dysfunctional behavior, being addicted to a substance, getting them back on track to where they were before they got off track. So recovery is functioning in the real world in terms of work and family and psychological well-being. So these are the main terms and concepts that we're going to be talking about, and I hope you are able to master them and use them both in the familiar sense and in the technical sense for which they were designed.